Welcome back to Access Health GY. Ladies, do you know that polycystic ovary syndrome or PCOS is one of the leading causes of infertility? 1 in 3 women visiting the Georgetown Public Hospital with infertility concerns suffer from PCOS. But not to worry, it can be treated in some cases. Let's get some insight from gynecologist Dr. Ademola Biala. So, Dr. Biala, what exactly is polycystic ovary syndrome?
Polycystic ovarian syndrome is just a big name that characterizes a disease in females in which the ovaries, that's where the female hormones come from, and that's where eggs that make babies come from. The ovaries are swollen with lots of tiny eggs that are usually not useful for fertilization.
Why exactly is it a problem?
So the problem with polycystic ovarian syndrome is usually because of fertility. So most women that have polycystic ovarian disease have symptoms that outlive the period of reproduction itself. So for example, the polycystic ovarian syndrome may be incidentally found when you're walking up a woman that is unable to get pregnant. In more than half of the cases in GPHC, that's what brings the women to the hospital. Some of the women come because they are not seeing their periods regularly. It's actually one of the things that young girls will be happy about. I mean, they can go to school, go play sports, and not worried about carrying a pad around. But in actual fact, as they get older and they now want to start reproducing, they now realize, hey, there's something wrong. I'm not getting pregnant. I'm not seeing my period. That's when they now present to GPHC for most of us to now see them as gynecologists and evaluate them.
So how is it diagnosed?
So the diagnosis of polycystic ovarian disease is usually by laboratory and imaging. You can also get a little bit on history. Most women do not see their periods every month. Some of them may see it like 3 to 4 times a year, and some of them when the periods come, it gets prolonged. So abnormal uterine bleeding is one of the hallmarks of polycystic ovarian disease, but it is not the only one. As women get older, because of the hormonal influences on the ovary, they are unable to release an egg. This inability to release an egg that usually makes a baby also has its other associated factors, like they now have more male hormone, which is called testosterone, which will make the women start growing facial hair. Some women will feel like, oh, it's a passing phase and it will go, but it doesn't get better. Some women would have more cases of acne and oily face. Some women would actually put on weight, and that actually has a large bearing on their self-image. It kind of makes them feel less women than they are. And eventually, most women come to GPHC as a unit, as a gynecological unit, to be able to address the problem of infertility, and that's why we see them in GPHC.
What are the major complications apart from infertility?
Polycystic ovarian syndrome actually outlives the reproductive life of a woman. I mean, in as much as I say that more than half of the cases we see in GPHC come because they are unable to get pregnant, the sequelae or the long-term effects of this disease outlive their reproductive lives. Like, for example, some women that do not ovulate often, they have changes inside the lining of their womb that can predispose them to cancer in their middle ages, in the 50s and 60s. So they do have a certain level of risk of endometrial cancer. Women that do not ovulate regularly, they have high levels of male hormone and high levels of insulin resistance, we call it. So they do have the tendency to grow big and fat or put on weight. Women don't like being fat. They put on a lot of weight. And having a lot of weight or being obese has its own has its own factors that go with it. High levels of cholesterol can increase the chances of having heart disease. Obesity can also increase the chance of developing diabetes. And the combined factors will increase their cardiovascular heart disease risk to very, very high levels. Psychologically, to some of these women, because of their low self-esteem from weight gain, inability to bear children, so much facial hair, having to go to the hospital in and out because they're not seeing their period, can also be one of the factors that outlives the disease. So they may have very low self-esteem, be prone to having depression, and some of them may actually have suicidal tendencies.
So are there treatment for this condition?
Oh, absolutely. So you can treat the symptoms of the disease, but you have to understand that we're looking at the long term when treatment starts. It's easy to treat the irregular periods. That's like bread and butter for the gynecologist. giving them oral contraceptive pills will make their periods come like clockwork, but that doesn't improve their chances of getting pregnant. The other thing you can do for their irregular periods is actually advise on lifestyle changes. Reducing 5 to 10% of their present weight may just allow them to ovulate naturally and they don't need help after that. The other symptoms like acne, first of all, you would advise them to use topicals, which they can get from a cosmetologist. They can use laser to burn off the extra hair or the hair follicles. But you can also use medications to try to reduce the amount of hair production on the face or anywhere around the body. In terms of weight gain, of course, I've said obesity is one of the problems that causes low self-esteem. You want to make sure that you put them on an exercise regimen. Of course, they will need a dietitian to help them with the dietary intake so that they can be able to lose some weight. And in those that are refractory to weight loss from exercise and diet, we would normally recommend metformin. And with metformin, you get the dual effect of weight loss and ovulation. So this woman's chances of being pregnant, which is their fecundity or fertility, is increased, and they are also able to lose some weight. And if all this do not work for fertility, we have fertility medication which we can offer to these women. And some women actually, even on fertility pills, they do not respond favorably. They may need to undergo surgery where we actually burn out the excess ovarian cysts, which are the pockets of water on the ovary that are not necessary. We'll burn them out, and that will reduce the amount of testosterone, increase their chances of ovulating spontaneously, and increase their chances of getting pregnant. Yeah.